Good afternoon, guys. Let's switch our mics over here. Welcome back. Hope you all had a wonderful lunch. I'm not going to lie, I had like 5 of those tiny mini desserts. How can you say no? And you don't feel guilty because they're mini, right? See, okay, there's a couple smiles. Thank you. And I see nods. Thank you. I feel supported in that. Guys, we've still got a great afternoon for you here. We've got some amazing panel discussions. Also, want to remind you that if you would like to revisit the conference once you get home, if you would like to share the link with family, friends, colleagues who weren't able to be here, you can go onto YouTube and just type in Health 2.0 Conference live stream, and you'll be able to pull that live stream up and relive the magic. So, an option to you. Also, another reminder, we would love to be tagged in your photos, LinkedIn, Instagram, Facebook, everything and everywhere. Please use the hashtag pound health, the number 2 and CONF. And again, it's just going to be so great to look over all of the memories and all the great connections that you've made. So we encourage that. Our next panel is really interesting. It's going to be a brain trauma management, a discussion on brain trauma management, a comprehensive approach to prevention, care, and research. Brain trauma affects individuals and families profoundly, altering lives in an instant. Acknowledging its impact, our experts will guide us through the essential strategies for minimizing risk, the importance of swift and effective care following injury, and the promising avenues of research that offer hope for recovery and rehabilitation. To guide us through the topic, we have our moderator, Leah Mix, as she's going to be bringing up our panel. Come on up, guys. Thanks for being here.
Thank you so much. Okay, come on up, panel. We're going to actually have our panel do self-introductions, and so great to have all of these wonderful human beings who have information for us on traumatic brain injury. Oh, you want to get a picture before we start?
Usually afterwards.
Oh, it's after? Okay. I couldn't see.
So these are the candid. So um, really great to have everyone in the room here today. And I just want to do a little bit of gauging of the audience. And so could we have a show of hands of people in the audience who in some way have some direct connection to TBI, to traumatic brain injury? You treat it, or you work with patients, or you've had it yourself, or a family member has had it. So great, great. That's helpful. So we'll definitely be interested in questions that may arise for you guys. And I really appreciate everyone for taking the time to be with us today. So we're going to just go through a round of introductions, and I'll start with myself very briefly. So my name is Leah Mix. I'm the CEO of Delphi, which is a healthcare consulting firm. We specialize in psychedelic healthcare and bringing psychedelic healthcare into the US healthcare system. The reason that I decided to help moderate this panel, I'm not an expert in TBI. I have worked with patients who have it. However, there is some innovation in psychedelic healthcare related to TBI. So I wanted to talk with some experts about it and kind of be a bridge to other people in the room who might not be experts in TBI, but have an interest in it. So I'm so glad to be with each of you here today, and just want to invite a round of introductions, starting with you, Robert.
Yes, my name is Robert H. Schistel, and I'm Professor Emeritus of Pathology, Environmental Health Sciences, and Radiation Oncology at UCLA. And I have 16 patents. And it's my mission in life to make all creatures in the world healthy, beautiful, and sane. And I can talk about my 16th patent, which is relevant to traumatic brain injury now or later, as you want. And I think I have approaches which could benefit traumatic brain injury.
Thank you so much, Robert. And Sam.
Hi everyone, I'm Ranjini Sampath Kumar and I go by Sam. I am a medtech consultant, founder of Finesse Consulting Group. The reason why I'm here on this panel today is I have my master's thesis actually on brain pressure monitoring. So I would be very curious to discuss my insights along with two experts up here.
Great. Thank you so much, Sam. Andy, to you.
Hi, I'm Andy Quinn. I'm CEO of Between MD. Our objective is to improve people's health in between doctor visits. And specifically, we're focused on those who are having traumatic nightmares, who might have suffered trauma, whether that be physical or psychological.
Great. Thank you so much. It's such a diverse group of specialized expertise. So I think that we're going to get some really interesting answers to these questions. And the first one is really a general question for you all, which is what do you see right now as the major challenges or opportunities or pain points in brain management trauma in terms of what exists and what doesn't exist yet?
I'm going to jump in a little bit. So I think there's an important distinction that I've come to understand better. So there's physical trauma that occurs that it impacts a lot of folks. There's also psychological trauma. So I think that one of the interesting things, especially in the past number of years, is there's becoming more and more data available to help differentiate the two, even though sometimes the treatment protocols might align if the injury has been dealt with. So that's kind of one of the things I see is more and more data being available on this topic. Does that make sense?
That's great.
I think I can rub off a little bit of what he has described. There are two types of trauma. And I think on the physical side of brain trauma management, there's a lot of products that I've seen as a consultant in terms of invasive approaches. But I think one area of opportunity that exists today would be on the non-invasive products, like whether it's brain pressure monitoring or more non-invasive products to know and understand better what's happening inside your brain.
Yeah, excellent. So these are important developments, both non-invasive data, non-invasive technologies, and I know Andy that's a description of the technology that you're working on is non-invasive.
Mhm.
That's great. And Robert, would you like to add to this?
Sure. Actually, it's a very good distinction between physical and mental trauma. So, my 16th patent is actually about mental diseases. So, what my chemical does, it gives you an energy boost. It increases your sleep quality. I'm now down to 5 hours of sleep. I needed 7 to 8 hours before. It gets rid of overreaction and aggression. It gets rid of addiction, all the craving is gone. It cures anxiety and depression within 1 or 2 weeks, which is the fastest ever. Um, it increases your memory. People become smarter. Um, and it cures Alzheimer's and dementia. And this is what's already patented. Now we're doing ADHD. I had 2 ADHD patients, which are completely fine. Then autism, PTSD, schizophrenia, and then PTSD, and also strokes. And that brings me to the physical trauma, because my 15th patent is actually um, about inflammation. My chemical is also highly anti-inflammatory, and physical trauma and also stroke is a huge inflammation event in the brain. So it should be anti-inflammatory, and it could benefit from for the resolution of the trauma and also regenerate your neurons. It's actually neurogenic. It does tons of things. Like I had eyeglasses for 55 years in my life, and 4 weeks after I started my own chemical, my eye doctor unprescribed my eyeglasses. Why? Because it completely fixes your neurons and your optic nerve and your retina, which are also nerve cells. So it's neurogenic. So it reconstitutes your nerves, which is great for after a trauma, after physical trauma. And it also aids, it gets rid of bruises. So if there's some bleeding, it might resolve that. And it also aids your vessels. Um, this is my 15th patent, like it varicose veins and spider veins also disappear. So in all these instances, it actually might benefit the physical trauma and of course also the mental trauma.
Thank you. Thank you so much, Doctor. And we're going to be circling back around to learn more from you about how this drug intervention specifically, I don't know that everybody in the room has the scientific background to understand exactly how what you're saying relates to brain trauma. So we'll circle back around and ask you more in-depth questions about that. And one thing that I sit with, in preparing for this panel and even now is that I encountered when I was doing direct service as a mental health clinician. I encountered patients with brain trauma, veterans and people who had gone through all various types of accidents and injuries. One of the things that sits really kind of heavy with me is that I know that sometimes it was known and it was caught and it was understood that that's what was presenting, that's what the patient was presenting with, and sometimes it wasn't known. And I have to believe that sometimes I missed it as a clinician, which is hard, but this is a very complex um, treatment. One of the things that I would wonder, and Andy, I'm going to toss this question to you, is if I'm a patient um, and I've been dealing with a traumatic brain injury for a period of time, what should I do to make sure that I'm getting the help that I need?
So interesting question. So a lot of the work we do is with veterans. So the interesting thing there is there's usually a event that happened. Let's say it was a explosive that caused a concussion. So there's an immediate known, here's our first, you know, documented traumatic event. But what we've discovered is that, if that event happened overseas, there might have been an evac, there might have been hospitalization, they might have had loss of limb. So there's 4 or 5 other events that have occurred. So there's one event that caused brain trauma. So that probably got treated right away. So the physical symptom was dealt with. Inflammation is a huge challenge. But then those other follow-on traumas typically go undiagnosed because people are focused on the event. So part of what we're doing is capturing data coming out of their nightmares. So why are you having this nightmare? Was it the specific event, or was it when you're in the hospital and strapped down 3 months later?
Mm.
So as we understand that, then that helps get better treatment because the treatment for post physical trauma might be different than the physical trauma treatment. Make sense?
Yeah, that makes a lot of sense. So pre and post can be very different, and there can be multiple things that result in some kind of trauma, be it physiological or psychological.
Hmm.
So teasing that all apart is part of what your technology is about.
And that's early stages because a lot of, people don't talk about that.
Mm.
It's interesting to see, it's
Yeah.
easy to talk about, I watched or, got blown up. It's difficult to talk about those other things that happened because they are not in the physical world. We don't know that that's a problem. Or if we're dealing with first responders who might not have been injured, but saw something very traumatic occur, where, that was the trigger for something that occurred. So I think we're starting to learn all about this.
Yeah, well, that really does resonate with me as a clinician,
Mhm.
because you don't always know, a person can have so many different things going on, and you don't always know which was the thing that impacted them the most. It's so personal, it's so individual. So it's great to hear that there's technology that's going to help to sort that out a bit. And it leads me to a question for you, Sam, because you are an innovator in the medical device space. And I'm wondering what you see as some of the opportunities in medical devices related to brain trauma.
Sure, that's a very interesting as well as broad question. So when you look at brain trauma management, standing a little bit behind, it starts with research, which could go anywhere from the understanding the chemistry to brain-machine interfaces or other device perspective-oriented research. And the next step is prevention. So that could run anywhere from a motorbike accident to wearing a helmet, which is part of the education and awareness that you want to create, as well as sports injury, where you need to follow protocols. So there is the education aspect for prevention. And when you look at the diagnostics and therapeutics, there are various number of devices out there, starting with like brain pressure monitoring to imaging, MRI, CT, functional MRIs, where on the imaging side of things, I see industry has been moving towards better accuracy and better mapping of the cases or studies, which has been done over the years. And similarly, in the therapeutic side of things, like deep brain stimulation, as well as other modalities that's been used to either help, support, alleviate things like Parkinson's and other area of the brain diseases. And then when you look at the psychological side, you do have rehabilitation and whether that's in terms of like using a drug, pharmaceutical things, or it is also going to be encompassing anything that relates to therapies, right? So there is a lot of opportunities out there, and I think we are just getting started.
Yeah, that's fantastic. Thank you so much. And it it sounds like there's a lot of opportunity for innovation in this particular space. One of the things I believe that falls of elderly people is one of the leading causes of traumatic brain injury, right? So there's work related or and that's includes vets, that's their work, sports related, and then elderly populations. And we have an aging population, so we could expect to see more of this. And really there's a lot of reason that that work that you're doing is so important for people who are going, some of us in the room today who are completely without brain trauma right now may experience this in our lifetimes or have a family member who experiences this in our lifetimes. So thank you so much for tracking where we still need to go and what, what could work better. And that brings us to you, Dr. Robert. It's great that you have so much expertise in this area. And one of the things I think would be really wonderful for us to hear about is treatment of uh, brain illness and brain injury from a drug perspective, and a little bit more about the mechanism of action, perhaps, of the drug that you have a patent for in this area, that helps us understand how it would cure or improve the symptoms of TBI.
Sure. So what the chemical does, what we know from the mechanism of action, it induces in our body 244 different proteins. And there's lots of DNA repair proteins and anti-inflammatory proteins, and also 9 neuroprotective proteins. So these neuroprotective proteins actually are that's most likely why it has such a large spectrum of diseases it can address. Um, Now with the DNA repair and anti-inflammatory proteins, it's probably most of these inflammation, and so it supports your own immune system, and thereby it gets rid of all the problems with the immune system. It fights infections. I can cure allergies, um, autoimmune diseases, infections. I mean, all the spectrum, which is and COVID and uh, long COVID, and it protects from COVID. So all the problems with the immune system go away. Um, so that's inflammation, also autoimmune diseases, which are part of this. Um, and then the 9 neuroprotective proteins, uh, um, it protects your neurons. It's actually neurogenic. It aids your neurons. It makes your neurons to to reconstitute and grow. Um, and it benefits your neurons, and therefore um, people see better because of the retina. People, I can cure mental diseases, as I said before. So, and it's very easy to take. The human dose is 1 gram per day. So it's half a gram in the morning, half a gram at night, and it takes 20 seconds to take it. You just put it in your mouth and it goes wherever it should go in your body. Um, and I'm a very unusual pharmaceutical, have very unusual pharmaceutical companies because I think most of the cosmetic and the pharmaceutical companies out there are greedy. Now I'm also in public health, so what I want to do is to cure more people. And I think it's a sad state if the government has to come in to reduce the price of insulin. Um, so what we do, I just give it to my patients for cost, meaning that that it pays for the production and for the shipment of the chemical. Um, where I get my money from is from investors and not from treating people. Um, so so it's $7 per day, which most people can afford, and the minimum, it's a clinical trial, so the minimum sign-up period is 4 months, so it's $840 dollars, and you're set for 4 months um, for this therapy.
Great. Well, thank you so much. So, that it's incredibly interesting. So, what I'm tracking with this is this is a drug that helps flood the body, flood the bloodstream with different proteins
Yeah,
that the body already knows how to use to heal
exactly.
itself. So it
Yeah.
sounds like this is
Supports your own bodily functions. Exactly. Yeah.
great,
To
great,
cure things. Yeah.
great. So
Your immune system, your neurons. Yes, yes,
and there seems like there's multiple mechanisms of action. So you have all of these
yes,
proteins. So it's dealing with, we know that inflammation and also the destruction of neurons are two of the key factors of
yes,
traumatic brain injury. So these proteins specifically help in those areas.
yes. And actually, the reason why I call it a chemical and not a drug is because actually it's the only chemical or whatever you call it out there that does not have any negative side effects. Okay. And so far, with all the diseases I cured, sometimes the most serious, like ulcerative colitis, and it's good for cancer, for really horrible diseases, or COPD, asthma. I mean, um, all the people in my clinical trials so far, none of them died, and none of them even developed a second disease so far. And this is since 15 months. Okay, and it's even good for the flu, for it gets rid of COVID, tons of things.
Well, that is very exciting, and it leads me to reflect. And I actually want to ask the three of you about some research that I'm aware of. It has to do with a psychedelic medicine called ibogaine. And this is the research of Dr. Nolan Williams at Stanford. It's only one study, so probably not as far along as Robert is with his drug. But what was found in 30 veterans, special ops veterans that had experienced an average of 39 blast exposures. So they were scoring in the mild to moderate range on the World Health Organization scale of cognitive disability at the start of the study. And all of them were scoring on the PTSD scale as well in the moderate to severe range.
Mhm.
After one session with the treatment of the drug ibogaine, 1 month post, there was a 77% of those study participants were no longer scoring. They had no score of disability. on the World Health Organization's cognitive disability scale, and 86% of them had full remission from PTSD. And so I I'm very compelled by that research, like, oh, there's something here that, possibly could be very helpful to people who have experienced at least this kind of brain trauma. It's, very complex. There's a lot of different kinds of brain trauma. But I just wonder, like, this was it just happened, so it was just published in Nature Medicine on January 5th. And I wonder, since you guys have been thinking about traumatic brain injury longer than I have, just how does that land with you? Just hearing that study.
So I'll throw out a couple of comments. So I moved to California about 8 years ago, lived near one of the VAs. And so if you talk to people who had experienced multiple concussions, the treatment protocols in general were suppressive. So they were meant to sort of uh, keep people's suppressed. Uh, They called it zombified, the patients. So that was one thing that existed. And if you go back a little bit further, I think there was a view that, our brain didn't, there wasn't neuroplasticity. There wasn't the recovery of the brain that was expected. So I think that effectively what we've sort of discovered through research and other things is suppressing sometimes is necessary, but not necessarily for 20 years. And the brain has great healing powers. And if we can assist it, that's really a positive thing. So that was kind of my take on it. I've heard comments from some special forces operators that effectively treatment protocols with psychedelics was helpful to them significantly. So I think that there's lots of areas for exploration and improvement there.
Hmm, thank you. Um, One of the things that comes to mind as you're sharing that, Andy, is the possible combination
Sure.
of,
Yes,
starting,
absolutely. Yes.
combining, because what we don't know, the research that I'm
Yes.
citing is only clinical outcomes. They, there's follow-up studies to do the MRIs and so on and so forth, but we do not know that it's actually fully healed the brain, that it's, healed the neurons, and so sometimes it is like combined therapies. This is, I think, very common with TBI, that there's multiple therapies that need to happen in order to fully heal it over time. It, did you want to say
Sure,
something
sure,
about
sure. I think so. So my chemical one can combine with anything. It doesn't. There's no counter indication with any other thing. And the best thing is if everybody continues to take whatever they used to take in the past, and then slowly they are weaned off all the other things because they don't need them anymore. But it doesn't interact with anything else either. So of course, if anybody is interested in the things I was saying here, I'm happy to send you information, to get your information, your contact information, and send you the information about all my clinical trials.
Great. Thanks, doctor. And he's wonderful with follow-up, by the way. So can take him up on that. You know, Um, I want to shift a little bit to talk about preventative care. And again, we'll
Mhm.
start with you, Andy. What type of preventative care can someone do to prevent brain trauma?
So physical was mentioned before. So you can wear a helmet, for certain things. Though I don't think we want our seniors walking around with helmets on. It would mess up their hair if they have it. So, so that's a challenge. But the other is really better mental health would be one area. Better preparation. So those are some things that we can look at, but it's a tough one because if you think about trauma, it typically comes out of some place you didn't expect it to. Even if you're in the military, you're not expecting, a mine to go off. You're not expecting to get hit. You're not expecting if you're playing football for that next interaction to cause damage. So I think that's a prevention probably comes in terms of better mental health or better physical um, protection.
Yeah. Great. I wonder, Sam or Robert, do you have any thoughts on prevention of brain trauma?
Yes, I think there's going back to the question of opportunity, like when Andy brought up the prevention. I think there is, so today when you're hit head on the head, or when you fall down, when you're taken into a screening room, you have 30 some questions to answer before even you are diagnosed with like levels of TBI. I think there is certainly an opportunity if we had like a diagnostic device instead of filling up a form to actually know what's going on, right? Filling a form is the last thing you want to be doing, sitting at a medical room when you go through that. So I think that's one area that I do see. In terms of like prevention, I think education is very important. Having protocols like sports injury are the maximum number of cases that you would find in terms of traumatic brain injury out of all other types that could lead to traumatic brain injury. So I think following protocols and having education around it.
Yeah, thank you so much. So one of the nuances of this is, and the doctor, we do want to hear from you. I think one of the nuances, though, to tease out is that there's intervention that can happen prophylactically, so before the event ever occurs, but it could also happen soon after the event occurs, which keeps the TBI from getting worse, right? So there's a whole spectrum there of different types of interventions, devices, drugs, whatever it might be, behaviors, activities. And it kind of depends on where the person is. We're all in a patient journey of sorts, and most of us are probably pre-TBI. So we've spoken now to things that we could do to prevent TBI if we were to have a type of event that could cause it. And then there's also, after an event does occur, what type of intervention at what juncture can keep it from getting worse, right? And that's a long journey, right? So this probably the sooner we intervene after the incident, the better would be my guess. Yeah.
Sure, in terms of prevention, there's physical prevention, and there can be always a combination of different factors how you to prevent injury. Um, but there's also what I call chemical prevention. And see, my chemical can prevent strokes because strokes, that's kind of an internal traumatic brain injury. Um, and the reason why it does that is because it gets rid of inflammation. And a stroke is a huge inflammation process. And that's also what actually happens during TBI. So um, so it could even be that people, and we haven't had anybody who had a traumatic brain injury on being on my chemical. It could be that somebody is actually chemically more resistant to it because this brain destruction caused by the inflammation is actually inhibited. So that could be an additional prevention factor, of course, in addition to also physical prevention and other taking care of your own steps and everything what people should be doing.
Yeah, that's wonderful. So I want to riff on this a little bit and just open up that question. So, um, to your point, Robert, you're saying that after the incident occurs, if there was an intervention such that the inflammation was reduced,
Right. If
the
you catch
the
somebody right
trajectory,
after
right?
the TPI, yes, the resolution could be sped up. But what I'm saying is that even before, maybe before you get to that point, you should be actually also more resistant to this.
Right.
Yeah.
Right. So we're living in a world right now where your drug is or your chemical is not yet available. So I just want to concretize the like the experience of TBI. So I'll ask you guys if I were to experience a traumatic brain injury tomorrow, what should I do?
Call me.
I just might. But in
Yeah.
terms of what's available,
Yeah,
in
anybody who has my information can always and I can send it overnight. So I have it in my freezer, and you can sign a release form immediately. Yeah,
thanks, Robert.
anybody who has my information can.
And thank you so much, Robert. And what I'd like to do is kind of create some contrast between, you know, what are the things that are available right now? What can somebody realistically do today if they or a family member or patient experienced a traumatic brain injury? We know, and we're so appreciative that the work that each of you are doing is a future state of how traumatic brain injury will be treated, diagnosed, managed. But what happens now?
So I think there's the front line. So, if there's an accident, what happens then? That's up to our medical community. And I think they're pretty good if there's brain swelling, they have protocols to help immediately deal with that. So I think there's a lot of good solutions there. One comment the doctor mentioned that I'll tie into. So we've worked with folks with traumatic brain injury. So one of the things we look at is sleep. So
Mhm.
one of the key elements around that, when I first met doctor, he said, "Oh, I'm down to what, 5 or 6 hours of sleep."
Mhm.
I'm up from 5 or 6 hours of terrible sleep to now good sleep. So our body does have the ability to heal itself. So getting good sleep is probably one of those both prophylactic and post event functions that we can do to help heal ourselves. So I think that that's an element that is something we're looking at, and so many of us don't know that, or we don't consciously know that. So I think that's an area that we can focus on. And even if we delve into sleep, some people have nightmares, some people have restless sleep. So there's elements of that we can work on, and stress and anxiety. So, that's another element where, especially in our post-COVID world, we're probably all more anxious than we were 5 years ago. So how do we help work on those things?
Awesome. Yeah. And Sam, I want to ask this question, but I'd like you to maybe speak to us a little bit when you answer this question about like what is now. You have a good lay of the land about the challenges with the existing products. So a lot of the interventions that Andy's speaking to require some kind of diagnostic tool or some kind of intervention, some kind of device, some kind of rate, and occasionally so in terms of innovation and the products that are available now, could you speak a little bit to that in your answer as well?
Yeah, sure. I actually had a comment on what Andy was mentioning. So, just as an industry wide, I feel the device in terms of brain trauma management or in terms of anything related to brain. I believe it's shifting more from the physical side to the psychological. And I don't mean drug in terms of that, but in terms of having an watch or some sort of tool that monitors your, things with your body, whether it's sleep, other functions, and that being integrated into an app. So it's shifting more towards mental health and wellness and other areas. And I think it's an amazing change given having seen and worked with so many companies in terms of like cardiac oncology space. Brain is one area that I've worked on. So I think the I see a trend shift. So that's definitely one. And to answer your question in terms of challenges, so when you look at like medical device perspective, uh, brain related products are very niche, like say cardiovascular or anything. I come from the catheter background in cardiovascular space, so, and as well as in oncology, I worked in biopsy. Uh, and I have about 10 plus patents over there and products in the market. So just from a point of looking at technology, I would say brain related products are in general harder because the innovation takes time. Understanding the landscape of what is out there and what are the opportunity that takes time. Plus, as well as in terms of the development, say I could speak to example in terms of brain pressure monitoring. Say when I was working through it, there used to be a lot of like drifting in terms of sensing. So efficacy and efficiency are two different things that FDA looks at. So when from an ideation perspective to bring a product out into the market in that particular space is still hard. And in terms of the opportunity out there, like I mentioned before, there are a lot of growth and need in terms of non-invasive device where the penetration is easier.
Yeah, that's interesting. So there's some systemic challenges with actually bringing innovation in this area in TBI. And it's really interesting. You're touching on again what we kind of started with, which is data, non-invasive technology, and so forth. And Andy, you're wearing some of that technology right now, right? And one of the things that really inspires me having the three of you here is that the two of you are working on, how can we identify when these things are happening for people, when these traumas are happening, when there might be something going on with the brain. There might be more people who are actually identified as having these issues than if they're just filling out a form, right?
Right.
And more patients for you to treat, doctor. And I wonder, as you hear, Andy and Sam talk about innovation, being able to use data, use non-invasive technology to um, identify and proactively manage TBI patients, how you feel that that relates to your work. That was the question was to you.
Oh. No,
I might have been. I was speaking a little
no.
quickly.
I was thinking about
Have you
what you
taken
Just
your
tell
said.
us what
meds
you were
today?
thinking about. Yeah, no,
What you said
we're having a
before,
conversation.
that the chemical is not available, and that it is available to everybody who who contacts me or who gets my information.
Well, thank you for clearing that up.
And the reason why I don't publish this and why I don't publicize it widely is because otherwise I have 200 million people who immediately want the chemical, and I cannot deal with that right now without a license from a pharmaceutical company,
Yeah.
because everybody has to sign my release form. And I don't want to have all these
Yeah.
unsatisfied.
And here I am saying there's a lot more people coming because
Yes.
Andy and Sam are going to help identify a whole bunch
Yes.
more people. So you could be
Yes.
flooded.
And so,
Yeah.
so Islam, yeah, sure. Um, and we're about 9 months away from FDA approval. So after it's FDA approved, it's going to be in the news everywhere. But before, um, still everybody has to sign my release form. So it is available to people whom I contact and who have my contact.
Great.
Yeah,
Thank you so much, Doctor.
absolutely.
I just want to touch on one more thing before we have kind of a closing round of questions and then open it up to the audience is something that you said, Doctor, about public health and accessibility.
Yeah.
And I just want to take a pause to thank you for that and to say how rare it actually is to have people. And I know a lot of people at this conference, in this room, on this panel are thinking in the same way. How do we ensure accessibility? How do we manage cost? How do we make sure that everyone who can benefit from these new technologies has safe and affordable access to them? And I really appreciate that you have oriented your work and yourself to that mission.
It might sound counterproductive for a pharmaceutical company that you don't make money on the product right now, but this is just because of the clinical trial, and because want to make, I don't want my patients to actually pay more than they have to. Where I make my money from is from investors.
Right.
Yeah.
Great. Thanks so much. Well, I just want to bring it back around one more time, and then we'll have a few minutes to see if what the audience's questions or reflections are. Is there anything else that any of you would like to say about innovation in this space? What's needed? What's missing? What you're hopeful for? So forth.
So I'll throw out something. So we're working with some uh, former football players who have
Mhm.
CTE. So effectively, multiple concussions lead to long-term problems.
Yeah.
And so basically, it really can't be identified to postmortem where they take a look at the brain, which is sad. So they are looking at measuring both MRIs, devices, and trying different therapies to help improve health while they're still functioning well. So that's exciting because there's, potentially the ability to prevent that long-term issue. Maybe there's other solutions that will help them further as we move forward. So I think there's lots of different therapies from um, traditional therapies, potentially psychedelics, cold plunge therapy, other therapies that exist that hyperbaric that might help these folks out. So that's kind of exciting to me in that there are different ways that we can approach this. And we're looking at qualitative and quantitative data.
Great.
So I think that's important to look at both how people are feeling and what the data says.
Great, Andy. Thanks so much. And I know part of your technology solution is to actually help match people with the therapy that is working for them.
Right.
Yeah.
Yep.
Wonderful.
Thanks.
Sam, and Doctor, would you like to have any other comments about innovation in this space?
Sure, I think, see, yeah, innovation, since I have 16 patents, I'm highly innovative, of course. Um, and what we need now is just to manage this, to get more people into my clinical trial, and then um, get 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 investors. So of course, you probably know by now that my investors make a ton of money. They my investors make 100-fold ROI, which is 10,000% within 10 years. So anybody who has $10,000 can invest, um, and anybody who gives me their name, number, and email address can get all my information.
Great, thank you.
Yeah.
Man on a mission. Yes.
Yes.
Yes. And Sam.
I think I would want to close off with a comment. I've seen multiple different products in this space. I think I'm curious to see if there's anything out there for neuroplasticity related like devices coming out. I think that's a opportunity area, and I'd be curious.
Yeah, yeah, that's great. Like they have some VR things now that are
Yeah,
really interesting. Shockwave
I
therapy.
think that would help rehabilitation so much better.
Cool. Great. Well, will we open it up to the audience and just see if anyone has any questions for the panel or any reflections, something that came up for you during this conversation? We would love to hear your share or your question. Yes, please. Hi. Great.
A patient that is dealing with this, but I was a victim of domestic violence. So, are you looking at? 'Cause I heard football and I heard coming out of the military, but what about men and women that are victims of domestic violence?
Sure. Sure. The cause is, yeah, there's all kinds of different causes of traumatic events, traumatic brain injury events. Sure. And yeah, yeah,
Yeah.
we can deal with anything.
Yeah. Further comment on that. So it's easy to identify with a veteran that first event. It's documented. One of the challenges with domestic violence is sometimes it's not well documented or it's occurred multiple times. And I think there's that unpacking that occurs. Certainly, from what we've seen of the limited data we have, there's high similarities between the challenges. So our hope is that as the work we're doing, as we improve, that it'll be available to more people. So that's the short answer is we're focused because we can find a singular event that's well documented, but then the other pieces are certainly there. Hmm.
normal things are actually related to that. So this is a very powerful conversation to hear.
Thank you so much. And thank you so much for your sharing. Really appreciate you bringing that into the room. And it reminds me of something, Sam, that you said about diagnostics. So one of the challenges, I relate to this as a clinician, and I certainly have worked with people who have had domestic violence, and I think that there's a lot of overlap sometimes in the symptoms of brain trauma and psychological trauma. And so it's not always clear what's being presented. And I think that education of providers in terms of asking the questions around, have you had these things happen? Have you had it? And making it clear to the patient that traumatic brain injury can be a part of domestic violence. And so we need to ask these questions and creating more of a motivation on between the patient and the provider to assess that this has happened. So education, and then Sam, what you said, if there was a diagnostic protocol that involved something that isn't filling out a form, something that isn't a questionnaire, but it actually is looking at are the physical symptoms there, that would reveal itself earlier on, and someone's not waiting, decades to discover that they have something that needs to be treated. Yeah,
Yeah.
yeah. Um, Anyone else have a thought, reflection, question? Oh, yes, thank you. Please, yeah, come on up. Sorry.
Wow. So you've got an event. Did you see physicians? Yeah. Wow.
Yeah. So some of the things that you want to look for is what was your functioning before the event, and what was your functioning now, what is your functioning after the event? And first of all, so sorry that that happened, and so glad that you are here with us today for having a conversation. Yay. So just diagnostically, some of the symptoms are going to be that you might notice are impairments in your cognitive function. So your especially your executive function. So your ability to plan, your ability to reason, your ability to remember information. If there's a dramatic difference before and after, that would be something to pay attention to. The other would be change in your mood. Maybe before you were pretty stable mood wise, and after you've noticed that you have spikes, right? Okay. And then another one to look for is things like physical coordination. So before the event, you were very coordinated and you weren't noticing. Now maybe you drop things, or your body isn't responding as quickly. So that is not to assess you. I'm giving you just a breadcrumb trail of how to look at, okay, that's what you want to look at. How different am I from before the thing happened to after the thing happened? If you're noticing that your quality of life is significantly different, um, that your abilities are different cognitively, physically, then you definitely want to follow up with a doctor, and do a deeper look at that. And every time I'm imagining you have continued to have this conversation with your primary care doctor, I would continue to have it in an ongoing way so that every year at minimum, if the symptoms are something that are coming on gradually, that every year you're going to have the conversation with your doctor. You know that thing happened back then. I want to make sure that my brain is in good health. Are we doing everything? Have we done all the diagnostics needed to make sure there's not an injury there? Am I doing everything that I need to do to make sure that my brain is going to be healthy long, long into life? Okay. are there any? Oh, great. Is anyone here aware of the technologies that she's mentioned?
I've got a partner who's looking at that, who's heard of some good initial data. Um, that's, I think that's an interesting area of research. It's probably the best way for me to put it from my comment.
Okay, well, wonderful. Thank you so much
Uh,
for bringing that up. Yeah.
to that, just my chemical improves memory, and Alzheimer's patients, you cannot undo the changes that already happened, but you can prevent further negative changes happening. And eventually, since it's neurogenic, eventually Alzheimer patients remember things better.
Hmm, great.
Yeah.
Thank- Thanks so much. Yeah, thank you. Thank you.
Thank you.
Okay, I think that was our last question. Well, thank you all for your attention and your participation, and thanks to our panelists. This was a really interesting discussion. I learned some things for sure. So thanks, and have a great rest of the conference.
Thank you.
Thank you so much, guys. So many great discussions happening these last couple of days, and it takes us getting together, all of you sitting here, all of your great minds working together. So, some really nice stuff. Thank you for your time, guys.